Good afternoon, is it afternoon? I believe it is. And welcome to, again, our Health Literacy UK lunchtime seminar. We are delighted that you are here and joining us for this really important talk that we're going to hear from Z and Mike. And we're delighted that they are here today. So thanks again for coming to this session, and we'll record it later, and you can put some comments into the Q&A, or are we using the chat, Anne, or the Q&A?
I think it's the Q&A that will work.
Yeah, we'll work from the Q&A. So if you've got any questions as we go along, we'll either pick them up as we go along or at the end, I suspect the end. And Anne, I'll hand over to you and let you introduce our speakers.
Thank you, Evelyn. So we're delighted to be back with the second in the series of the health literacy webinars during October. So today's session is Community Health Champions, and the title is it's a health literacy project, isn't it? We're delighted to have Z Khumalo, Community Health Champion Coordinator from Voluntary Action Stoke-on-Trent, and Dr. Mike Oliver, Health Psychologist and Health Literacy UK Steering Group member. Voluntary Action Stoke-on-Trent is currently coordinating a Community Health Champions project. Initially, the project is focusing on promoting positive messages and dispelling myths around COVID testing and vaccinations to ensure everyone can make the right health decisions and protect themselves. Over the time of the project, it will expand to ensure understandable, accurate and accessible health information is available to help residents make better choices for their long-term health and well-being. The role of a community health champion is all about talking with people and, most importantly, sharing good information on health-related matters. In this webinar, you will hear from Z Khumalo and Mike Oliver how health literacy has been put at the heart of this project. So you're very welcome. Z Khumalo is the project coordinator for Community Health Champions project in Stoke-on-Trent. Z has worked in the voluntary sector for over 12 years, supporting older people who lived alone and who struggled to access services. Prior to this, Z worked in a variety of roles, including in law, banking, and domiciliary care coordination. Z came to the UK as a refugee and is now a UK citizen, so comes to the world of health literacy with a wide range of experiences to draw on. You're very welcome, Z. Mike Oliver is a health psychologist and a very familiar member of the UK Health Literacy Steering Group. Whilst he is working in the public health team in Stoke-on-Trent, Mike was the project manager for the health literacy work that was coordinated across the city. He now works as an independent practitioner, supporting community and public sector organisations by raising awareness of the subject and providing them with accessible and practical ways to improve health literacy. So we're really delighted to have you both here. The session, after the presentation from Mike and Z, there will be an opportunity to ask questions in the chat or in person. So I can unmute anyone that wants to ask the question, and there'll be a time for discussion afterwards, which will be really valuable. But we're really excited to hear from you both, and best of luck. Over to you.
Thank you very much indeed, Anne. Hello to everyone. I've seen a few familiar names on the participant list, so thank you very much to those of you who I've met before, and lovely to meet virtually some new people as well. So looking forward to spending this time with you and Z to share our little story. So just what we're going to go through today is just say a little bit more about ourselves, although I thought Anne's introduction was lovely. I wonder who wrote those. That was quite nice.
Did a good job.
Yeah. And then we're just a little setting the scene in terms of the pandemic and health literacy, and then into the meat of things, talking about the project that Z is leading, the Community Health Champions project, and then just a thought on the future of the project as well. So that's what we'll be covering. So just in terms of introductions, Z and I only met about 4 or 5 months ago. We actually haven't met in person yet, but I can't wait until we can. but it feels, I don't know if it's the same for you, Z. It feels like we've known each other for years. So we've just kind of hit it off. We've hit it off really well. And it's an utter pleasure to be working with Z on this project. So Z, could you just tell us a little bit more about your life and career to date?
So I first came to UK in 2001 from Zimbabwe. So very different, interesting health systems there. And I found my home in Stoke on Trent. I studied and dabbled in law initially, but that was far too removed from people for me. As you can imagine, I'm a chatterbox, and that wasn't giving me that. As Anne mentioned, I've worked as a care coordinator, I've worked in banking, but I found my passion in managing volunteers and motivating people. I am a wife, a mom of 2 young men, 18 and 22, who have needed some hand-holding during this life of the pandemic.
Right, thank you, Z. And prior to this project, what did you know about health literacy?
To be honest, nothing. That is not a proud confession, I must say. I have worked in various projects in the voluntary sector for projects that say they promote health and well-being, but I'd never really looked at health literacy in the way that the training that we've done with Vast and Mike has. So actually, what I thought I knew was nothing at all.
Right. Thanks, Z. That's very honest of you. And I think you've been on a bit of a health literacy journey over the last few months. So that's what we're kind of going to explore in this session now. What I just thought I'd do is just set a little bit of the context in terms of the pandemic and health literacy. I'm sure you'll all enjoy seeing some of these words as they pop up on the screen, and ask yourself, 18 months ago, would you have known any of these words? And I'd also say to you, do you really know what some of them mean now? And even if you do the people you work with or the communities that you serve fully understand what they mean and what actions you need to take as a result of some of these words? So we've had swab test, we've had antibody. I'm not going to ask anybody to come off mute and explain any of these, but it's quite fun trying to explain these to people. But these are words we've been hearing constantly for 18 months. Herd immunity. It's a word from epidemiology. There you go. There's another word. Epidemiologists have never been so popular. I'm sure you all know what viral shredding is. Shedding, incubation period. There's our famous epidemiologist. You'll probably know polymerase chain reaction as PCR or PCR test. I don't think it matters that it's called a polymerase chain reaction, and I don't know why it's called a PCR test. But we've got used to these words. Antigen. Not quite sure what the difference between an antigen and an antibody is. I'm sure it's important. Viral load. The R number. We don't hear so much about the R number now, do we? That's kind of fallen out of favour a little bit, but we were hearing a lot about that at the start. And a rather important one, asymptomatic. So that was just to kind of set the context. And Z, I was just going to ask, given your house of boys and men, what's your experience been throughout the pandemic?
I like to label myself as somebody who's got a bit of background in, with education and stuff. But I must say, I found myself really confused. So very often I'd be listening to the news briefings and they'd be pointing to the left where supposedly there's a graph that nobody can see. And they're referring to you as you can see on this graph. And I'd be so confused. And definitely, got stuck on the words and lost the conversation that was being had because I was trying to figure out what the words meant.
Thanks, Z. So there's this, we're presented with a whole series of new words, which may be in a sentence that requires us to do something and act on those words. So in terms of health literacy, that's what it's all about. It's there's one thing understanding the word, but then do we have the ability to act on it? Just thought I'd share this. This is one of my favorite images from the pandemic. So again, I'm not sure, and we know, don't we, Z, that from the work we're doing with various community groups, can you remember the person, when we've done some of this health literacy work, can you remember the person who said that they just didn't know what asymptomatic meant?
Yes, it was a family member that was told that they could go and do a test if they were asymptomatic. And they thought that that meant asymptomatic meant they had symptoms. So they turned up somewhere where they shouldn't have been to collect a test kit, potentially putting others at risk. Yeah.
So thanks. So we've got this lovely picture with words that many people will struggle with, and also I love the directions there. So you can take your pick which direction to go on this one. And then here's one of my favorite from just normal times, whatever normal is. So phlebotomy, there you go. That's a lovely word at the best of times. Again, it's having its moment in the sun with all the tests that are going on. But I've always been intrigued by the word subweight because it's not a word that we use in common language. And it's sometimes when I've asked people who work in hospitals, they look at me like I'm stupid. Well, why don't you know what a subweight is? Well, I don't. You do because you work in a hospital. But I Googled it. I Googled an explanation of subweight. And here's the explanation from an NHS trust, which I won't name and shame. Patients book in at a central reception desk where they are given a numbered ticket. All patients wait in one area until they are called through to the next subweight area of the speciality they are waiting for. This ensures confidentiality, as the announcement states only a number and an area. Finally, they are then called from the subweight area to a consulting room. So anyway, I hope that's cleared that up for you. And then just a bit more context, certainly in the project that Z's running, we happen to be in Stoke-on-Trent, and we've done a lot of work over the years in Stoke on health literacy. I used to work in public health and was very involved in that work. And there was some wonderful research which gave us the baseline, which told us the health literacy levels across the city, but also very specifically in different parts of the city. And as you could probably imagine, the health literacy levels sort of track the socio-economic trends within the city as well. And there are some other observable patterns where people who are perhaps a bit older or have come to the city from a different country, or may have been poorly for a long time. There's various correlations which link with health literacy. So we've got that pattern in our city, and I'm sure it's pretty similar in cities a bit like Stoke across the country. So that was the context. So what's going to move on to now is just explain a little bit more about what the Community Health Champions project is and why it was set up and how it came about. So Z, could you just tell us a bit about the Community Health Champions project and why it was set up?
So the project was set up in partnership with Stoke-on-Trent City Council in response to the pandemic. The project was set up to be able to disseminate information to the local community in a very hyper-local way. Stoke-on-Trent, as you know, or if you don't know, it's an area of high deprivation, and that comes with it even more increased levels of struggles with literacy. So the project works with local members of the community and organizations to share information with people in a language they understand, in a way that they then know what to do with that information to keep themselves safe.
And how did these community groups find out about the project?
So VAST being an infrastructure organization, we have a lot of links and partnerships with other organizations in the city. We are sort of like a hub, really. So we've used those partnerships to share information about the project. The project did come with £150,000 that could be given to community groups and organizations within the city to help them sort of get themselves going after the lockdowns. So people, it wasn't difficult reaching organizations because people were also interested in the money side of things. And we continue to network and share information about the project wherever we can.
Thanks. And just from my memory, the funding's come through the City Council, but it was part of a national government initiative. Quite a lot of money was made available to local areas. So
it was,
Stoke,
yes.
Yeah, so Stoke isn't on its own. There are other local areas who've benefited from the money that's come down from government.
Yeah, I think a lot of it as well with the reason why they went to VAST was because not that Stoke's particularly special in this regard, but it was in recognition that actually members of the community wouldn't be as receptive to the council telling them what to do. So going to an independent organization that is already embedded into the community was a better way of moving forward.
Cool. And can you just paint a picture? What are you hoping that if an organization and some of its members become champions, what would they be doing?
So we are working with a specialist project. So what I mean by that is our brief originally covered working with the BAME community, people with disabilities. The brief is always wider because you can find those people in attending other groups that don't specifically cater for their disability or their limitations. So what we do is we work with the champions from those groups by sharing information and working with the champions to produce bespoke communication materials that group is more likely to engage with. So for example, talking newspapers in the city, there's no point in us sending them an email briefing every week. If what we need to do is we need to tailor that in a podcast way, because the people that use that service are used to pressing a button and listening to a podcast about the news for a fortnight or something like that. So we very much tailor the communications based on what the organizations or the community groups are asking us.
Cool, thank you. And right at the start of the project, somebody very inspirational wrote this, and I'm going to ask that very inspirational person to read this out. So, Z, would you mind?
Oh, Mike, you know how to put me on a spot. So just to give context, we were trying to come up with materials of sharing what the project is in a nutshell. So I'll read as I'd said it. There's a lot of messages that come down from government, and sometimes it feels as though it is not meant for us because it's not written in the language that we use. It does not mention our locality, so it's quite easy for that information to be dismissed. The role of the champions is to communicate information at a very local level in a way that people most likely to receive it. Listening to somebody who speaks like you, telling you about something that is going to be helpful for you, that makes you more likely to notice, because actually, yeah, that does apply to me because my neighbor's talking about it, or that lady down the road is talking about it.
Thanks, Z. That's brilliant. Sounds much better when you say it rather than me.
That did not sound strange at all, Mike.
Then, so what we've just got on this slide is, and we're not going to go through all of these. It was just to show the kind of the amazing collection of organisations that have come forward. So, obviously, many of you aren't from our wonderful city, but you can kind of get a feel from this, from just some of the different organisations there, because we will go into a little bit more detail on some of them in a moment, but it's just to show the number that have come forward and kind of the breadth of organisations. From there's a couple of ones for older people, for asylum seekers, the sports people, arts organisations. It's just an amazing collection. So what we thought we'd do is just bring it to life. So Z, do you want to tell us about some of the people and what they're doing?
Well, we've got such a wide variety of individuals. So as you can see there, we've got a lovely lollipop lady who is our youngest yet to volunteer at the age of 22. She loves a good chat, as you can imagine. So she loves to share information with the students outside the school gate as they're coming out. She talks to the mothers, sharing information about, what is happening in the world of health and well-being that week, in particular COVID. So she's quite a character and is not afraid to make conversation. We've got lovely representation there by Postman Pat. We're very honoured to have him. We've got a gentleman who is a postal worker at Royal Mail. He is also the designated mental health first aider for the organisation. He's such in a privileged position to be able to share that information, because people do actually approach him with when they're quite vulnerable or they're going through challenging situations. So they're more likely to really take in what he's sharing with them, and yeah, he's a good guy. We've got the chattiest of our champions. She is a housebound person herself, but she's a telephone befriender for a service locally that provides telephone befriending for those who are lonely and isolated, and those are older people. Very often she talks about how there's quite a few of her clients where she knows that week her phone call will be the only meaningful conversation that they have. And it's a very trusted position where they are more likely to take on what she's saying. And also it's that thing of when you hear things on the news, it's always good to bounce it off somebody. So she's always that kind of person for them. As you know, we've all taken, different cities have taken on refugees, and it's been particularly highlighted by the evacuation from, I've just gone blank, Mike, help me. Afghanistan, yes. So we've got local organizations and individuals in the community that work and support local refugee groups. Here, our champions come into life in that when we produce comms and it needs to be interpreted into another language, or it needs to be read out to somebody where English is not their first language, there's different champions that will speak a different language somewhere, and we're able to reach that part of the community that would otherwise struggle to get information. Also, just on that, I put myself in that category as well as a refugee in the country. When I first came into the country, the health system is so different from where I've come from. So having somebody to sort of hold your hand through a very key, important stage of your life, they're so trusted, these champions, that really the uptake of whether it's testing or vaccine, the success of that sometimes is owed to just the work that they do with their communities. We've got a wonderful organization called Middleport Matters. They support their community in Middleport, and they get people walking through from, you know, not to 100 if they live that old, to be that old. And they could walk in with any manner of concerns, and they usually handhold them and signpost them. When we were doing the training with Mike, we had a flurry of activity with the staff that were on the training, and conversation, you know, came up about, you know, what's happening in the background. They've actually taken on a mother and toddler group that had lost a meeting place, and they'd offered their facility to the community, and they now have that trusted place and that audience with those mothers that would otherwise just be stuck at home during school holidays without support, and they're able to share messages that affect people who are raising young children. Breastfeeding was another one, a concern where people are saying, can I have the vaccine during breastfeeding? They're the best people to be able to share those messages. So lastly, we've got our giant, Stoke on Trent City, who run quite a number of groups that are all centered around promoting health and well-being, and they attract a different cross-section of the community, and they'll cater for people with disabilities, again, BAME communities, women, men. So again, they're in a good place to be able to share information around keeping safe health and well-being.
Cool. Thanks, Z. So that was just to bring a flavour out, and I think the word that just came up there time and time again was trust. So there's one thing about having these trusted people, talking to people that know them, trust them, love them. So what we were then doing was overlaying health literacy into those interactions. So what we've been doing every time somebody comes on to that joins the project, they get an induction sort of training session, if you like, but it's all centered around health literacy. So the health literacy session has effectively been the induction, and Z and I do that together. So just obviously this isn't to go through the course now, it's just to highlight that, you know, we share what health literacy is, share some of the information about what the levels are in the city, certainly within the different groups, because as I mentioned at the start, it'll be higher and lower depending on people's life experiences, etc. And then we do some activities which I'll share in a moment around empathizing with what it might feel like to have lower levels of health literacy, and some specific techniques. So one of the things that we do is, as I say, this thing around what might it feel like, and I start off with mine. This is my literacy challenge. We take it away from the world of health. I've got a real challenge with cars and mechanics and replacing parts on cars. So I have a bit of a real challenge around those moments when I have to go into the world of the mechanic, and that really troubles me, and I do genuinely find it really, really hard. And I also know I've got to make a decision, which will invariably involve spending a lot of money as well. So that's not great for me. But Z, what we do is we ask people, what are the situations you feel uncomfortable in life? So Z, can you remember some of the things that our champions say when we ask them that question?
Yeah, money is one, when they have to make decisions about spending. IT is a big one. So if something goes wrong with anything that's technical or IT, people find themselves absolutely frightened of having broken the machine. Or if somebody's on the other line talking you through what to do. I'm just trying to think off the top of my head. Some people say when they are going into rooms full of people they don't know, that they've never met.
Yeah, we've had a couple around having things fixed in their house. So boiler literacy, just, you know, having to have your boiler replaced.
Yeah.
And then we thought a really nice one the other day, an interesting one, where there was a young lady who was referring to her and her partner who just got a puppy, and they had to go and buy stuff for the puppy, and they went in, you know, to a big pet store, and just felt overwhelmed by all the things that you should you buy, shouldn't you buy, what does this puppy need, it's a small puppy, will it grow? So just faced with all those decisions. So what we do on the training course is just help people empathize with how hard it is sometimes when you're faced with difficult language, difficult situations, and faced with the fact you've got to make a decision. And to be honest, I've done a lot of this training with health and care professionals, and I actually find this activity easier to do with just members of these communities than I do with health and care professionals. So that's just been part of the course. Something else we do is we share a particular technique, which I'm sure some of you on the call will be familiar with. Again, I'm not going to go into details now, but it's called Teach Back. Probably, I'd say, one of the most famous health literacy techniques, which is all about checking for understanding and not sort of blaming the person for not understanding, to taking the onus on yourself. Have I done a good job or not? Have I done a good enough job of explaining this? And again, rather than throw people in with health examples, we have a little activity where people teach each other to make chocolate cakes, which is quite entertaining over Zoom. Yes. I can't wait till we can get back into the classroom, and perhaps we may even do this. See, perhaps we could actually make a cake.
I'm not opposed to that.
Okay. So that was just to give you a flavour. So with the flow, we've got people on board, they're trusted members of the community, and we provide them some tools and techniques in a friendly way to help them interact and communicate with the communities that they're part of. So just sort of heading towards the end, really. There will be some time for questions if people want to ask. Do you want to share, Z? This is share an example of where something's working. And do you want to say why there's a picture of a tree as well?
I'm going to share about a project called Human Nature, who are doing quite an amazing job using their health literacy. So part of the project is we do Q&A sessions with the champions, where we can have members or colleagues from public health or NHS come and answer questions in real life for the champions. And a gentleman from Human Nature said, I was able to support somebody who was going through a mental health crisis. They were feeling suicidal. And because I was worried that I had shared enough information that they could use to keep themselves safe, he said he used the Teach Back method to be able to say, look, I know, it's quite a stressful conversation we've just had, and I just want to make sure that I've given you everything that can possibly help in this situation. Do you mind letting me know how we've agreed to move forward? So the person was able to relay what they heard, and he was able to then emphasize some bits that the person had maybe missed the gist of or had not got all the information. So they are actually using the techniques from the health literacy training to support the members of the community.
Yeah. Thanks, Z. And I think that's a really powerful example, very powerful example in action. So we've got different members of the community groups talking to various people. And obviously it was set up as a response to the pandemic and to COVID, and the focus has been on COVID-related matters. But just a question for you, that says future.
Yes.
How do you see, or how would you like to see the future of this project?
Now my brain's going to get away with me here, because I want to do absolutely everything and solve world hunger. But realistically, I think in the city, from the conversations that we're having with our public health and national health service colleagues, there's recognition that Stoke on Trent should have already had a big community health champion project that works in the way that we're working. So thinking about expanding the project past COVID, we are looking at and using the feedback from champions to say, what are you picking up as gaps in service provision in the area, and what can we do using champions to plug that gap? We're already sharing information that is not necessarily COVID messaging, as in that this is what the guidance is right now, but we're looking at what long COVID looks like. So what do people struggle with at the moment with people going back into work? What are their anxieties? So mental health is coming up as a big issue. Prevention services, so things like cancer awareness, encouraging people to stop smoking, all that sort of stuff is really, really going to come into play. So I'd say the future looks bright for the project. And at the moment, the conversations we're having are really promising. So the future's, it's limitless at the moment.
Yeah, thanks, Z. Just my very personal view is I think it's a wonderful thing to be able to listen to the communities.
Absolutely.
One could argue that there's been certainly public health. I mean, generally, I don't mean specifically in the city, perhaps a top-down approach across the years and in some places. So to have this bottom-up, this is what we need to know about, this is what our concerns are. So I think it's a nice channel so that people can express what's important to them.
Yes, absolutely.
So that's pretty much it, really. We don't want to keep everybody too long. What we would be utterly delighted to do is answer your easy questions. Clearly, if you've got any difficult questions, please keep them to yourselves. But I think we can open it up, Evelyn or Anne, so that if people do want to sort of come off mute individually, I think they could come on and ask a question or put something in the Q&A. Would that be okay, Anne?
Yeah, thank you, Mike. Thank you, Mike, and thank you, Z. That was really, really interesting. If anyone has a question, as Mike says, you can put it in the Q&A box, or if you wish to ask it and have a chat, I can unmute you and you can join. So for now, I'll just stop the recording if that's okay.